So I'm Jean-Luc Tilly. I'm the program manager over healthcare ratings at the Leapfrog Group. And today we'll be talking to Sue Sheridan, a founding member for Patient Safety U.S. Sue is also, of course, on our patient family caregiver expert panel at Leapfrog and has been actively involved in our recognizing excellence in diagnosis work. And this includes a recently released report where we outline some best practices for hospitals that are specifically aimed at reducing diagnostic errors and harm to patients. So Sue, can you talk a little bit about your connection with Leapfrog in your own words?
Yeah, well, my connection with Leapfrog, I mean, you shared what I've done as a patient activist, but my connection with Leapfrog, and what really draws me to Leapfrog, are really two issues. One is that since its inception, Leapfrog has been laser focused on patient safety, and in this case, diagnostic safety. And while our leaders, our agencies, our government agencies over the years have drifted away from safety, Leapfrog has not taken their eye off the ball of safety. And so your leadership staff, I applaud them all because I've watched them, this organization, over the years. The other reason why I gravitate so much to Leapfrog is the commitment to transparency. And, as a mom, I am pretty much the lead in our family in healthcare. And so I want to be empowered with information about hospitals where I can understand, their rating. You mentioned their A, B, C, D, and so this transparency gives me a choice to compare hospitals and decide where I'm going to get my care and where my families get my care. So I say those two things really draw me to Leapfrog: this patient safety and the transparency.
And I understand, I mean, you have a personal story to share about diagnosis, a diagnostic error. Can you tell us about that?
Well, yeah, and Jean-Luc, I have two stories, as you know. What brought me into patient safety 29 years ago was the birth of my son, Cal. Normal delivery, normal pregnancy, but Cal suffered brain damage when he was 5 days old in the hospital from the failure to acknowledge and diagnose the severity of his newborn jaundice. And there was a series of events that led to that. They just failed to diagnose and treat in a timely manner. And Cal now is 29, has significant cerebral palsy, hearing impaired, speech impaired, mobility impaired. But they failed to educate me as a patient about the warning signs. They failed to really engage me in the whole process. They failed to acknowledge my concerns in looking at how they treated Cal, and they did not follow evidence-based guidelines. So it was kind of a series of issues that led to Cal's harm. For years after Cal, my late husband Pat experienced a diagnostic error as well when a malignant pathology of a tumor that was in his neck. There was a failure to communicate that malignant pathology to the neurosurgeon or to us. Basically, this pathology got kind of lost in the system, and it resulted in the tumor metastasizing throughout Pat's spinal column, and it killed him when he was 45 years old. Cal was 6 and my daughter was 2. So, I saw these two remarkable diagnostic errors. And in Pat's case, there was a huge system failure. They failed to close that loop, as we talk about. They failed to inform us when we were discharged that they were pending test results. And so this is what brings me into this world, and that's why I'm such a fan of Leapfrog.
Yeah, well, I mean, thank you for sharing that. And I mean, so we do have this report, recognizing excellence in diagnosis, recommended practices for hospitals, we call it. And this report has 22 recommended practices for hospitals, to reduce diagnostic errors, where we've worked with experts such as yourself and physicians, nurses, employers, and we are hoping maybe that you could just share. 22 is a lot to choose from. Are there some recommendations that you see as being really the most important for patients and family caregivers?
Well, like you said, all of the recommendations are important, and all of them working together will provide a safer diagnosis. I think just from my point of view, I think that in thinking about diagnostic safety, that diagnostic safety is probably more than any other patient safety issue. It is in terms of getting an accurate and timely diagnosis, it is inextricably dependent on the patient. And so, so I really gravitate to your recommendation about setting goals at the hospital about patient-family engagement. And there's so much a hospital can do in helping the patient get the right information. Provide us with the right information to begin with. You know, in Cal's situation, they did not give me the right information. They said jaundice is normal and don't worry. And in terms of, they can empower us with information. They can give us access to our medical records. They can really invite us to be part of the diagnostic process. They can provide us mechanisms to report, diagnostic concerns or diagnostic errors. They can give us mechanisms to escalate care when we're not getting the right attention or information or the right treatment. We need to have a mechanism to escalate care. And in so many cases, that's what's necessary. I mean, and at the hospital level, at the higher level, hospitals can they can create infrastructures that embed us, their patients, communities, family members in policy making, creating programs and strategies. Embed us in infrastructures such as patient family advisory councils, because we can help the healthcare system redesign itself based on the needs and preferences that we have. In a hospital, I can't believe that any hospital will be patient-centered unless they have patients sitting at the table helping design everything I just mentioned. So that's one that I really gravitate. Another one that I gravitate, of course, is the measurement piece. I think it was monitoring and measuring the incidence of diagnostic safety. And the thing is, or diagnostic events, the thing is and this is something that patients fear, is when events like that happen and they're not monitored or measured, they become invisible. And so if healthcare systems are not doing that, that's an unsafe healthcare system. And so that I really gravitate to that. Of course, I would end by saying, because I know I have to be short on this, but I'd end by saying that, if hospitals are not disclosing the diagnostic errors to their patients and families, that means they're not disclosing it really probably to anybody, and it gets buried. And so I think that disclosure recommendation is also very, very important.
Thank you, Sue. I really appreciate that. I think you're right about how all these different practices can work together to hopefully
Absolutely.
play off one another to improve those outcomes and reduce harm. So I mean, and thanks for sharing your story and to help us highlight some important areas of this new report. And
Of
for more
course.
information, you can visit leapfroggroup.org.